Welcome to the Nursing Student Adventure here in YouTube. We're going to be looking at NCLEX questions. And what I'm going to do is look at a question and then let's go over on how we're going to answer the question. We're going to figure out the correct answer, but at the same time, we're going to figure out the steps on how to find that correct answer. And we're also going to make suggestions on what the rationale of the correct and incorrect answer is. So let's start with question number 1. And so when you're reading your NCLEX question, y'all, or your classroom exam in your nursing school, you need to read the question at least twice, and then at the same time, start taking notes. Now, in my screen here, I can actually highlight it because I'm using an iPad. But when you're taking your exam in your classroom, you're not going to be using an iPad, right? You're going to be either writing or it's probably going to be a laptop wherein you can't really highlight. One of the things that I recommend is start writing pertinent data based on the stem. So the question is actually the stem. And then, of course, the 4 are the options, right? So let's read this together. So a 72-year-old patient who has a history of heart failure. So I'm going to highlight heart failure. Admitted to the medical surgical unit because of a weight gain. It says 5 pounds in the past 2 days. And then the patient has severe difficulty breathing. So the patient is having shortness of breath at the same time, tachypnea, right? Upon admission, the nurse knows that the patient is getting restless because he's breathing very, very fast at 30 breaths a minute. And then the oxygen saturation is 87%. This is in room air. So auscultation reveals crackles. So that's another thing that we're going to highlight throughout the lung field. And then we're going to look at what is the question being, what's the question is, what is it asking in the question? So in here, it says, what action should the nurse implement first? So that tells you just that keyword in there. They're trying to find what is your priority, right? So everybody's know what prioritization questions are, right? So that's what it's asking. Now, a couple of notes, right? When we say the patient is on room air, we're actually talking about an FiO2 of 21%, right? So just remember that, just like basic understanding on how many percent of oxygen that is when we say room air. So let's look at the choices. It says administer the prescribed stat dose of intravenous Lasix or furosemide. Letter B, obtain a blood sample for a brain natriuretic peptide, which is BNP level. And then letter C, position the patient in a high Fowler's position and apply supplemental oxygen. And then letter D, perform a 12-lead ECG to assess for dysrhythmia. So let's look at the choices one at a time. So let's start with choice letter A. So it says administer the prescribed stat dose of intravenous Lasix. Now, if you look at it, yes, one of the medications that you're going to see when patients have crackles and patients have congestive heart failure, right? Crackles and congestive heart failure, more than likely you're going to see, if you look at their medication record, they're going to have Lasix in it. But the question that you need to ask, do I give that first because it seems to be an invasive medication, right? Of course, you're going to give it IV. Or is that a first thing that I need to do as a nurse, right? So if we look at ADPI, right, and you're going to see this a lot. If you look at ADPI or nursing process, we're talking about interventions towards the end. Now, is that a priority at this stage? The answer is definitely no, right? You can do that later on, but that's not the first thing you need to do. No, it's asking, what's the first thing that you need to do as a nurse? So A is incorrect. And then let's go to letter B, and it's talking about obtaining a blood sample for BNP level. So BNP level. So think about this. So when we call the lab to stick the patient and get the blood, how many minutes or perhaps hours do you think you're going to have that result, right? Perhaps 30 minutes, perhaps 45 minutes, perhaps an hour, or perhaps 3 hours, right? So now this is the process wherein we call delayed care, right? You could have been doing something already to help with the patient, but hey, you opted to call the lab and stuff like that. So in this particular scenario, letter B is not the correct answer. Now, it is a correct answer, but it's not the correct answer. That's not the priority. That's not the first thing you need to do. Okay, so let's look at letter C. Position the patient in a high Fowler's position and apply supplemental oxygen. Boom, shakalaka. So the patient is breathing faster, right? The patient has difficulty breathing. What can we do to help that quickly, right? Elevating the head of the bed, right? Positioning the patient in a high Fowler's position. And then the O2 sat is 87% at this time. I know we know that the patient has crackles and the patient uh, has weight gain, but at this time, at this case scenario, when you apply the oxygen, you can help a little bit with that oxygen saturation of 87%. So let's gonna put a little check on that and see that that would be a correct answer or not. But let's go to letter D. Perform a 12-lead ECG to assess for dysrhythmia. Now, this is one of those things in NCLEX wherein they kind of make you, they kind of have a choice that really looks good. Now, letter D really looks good. And you know why? Well, the patient who has congestive heart failure will more than likely have some ECG problems, right? Some dysrhythmia. So this really match the case scenario of CHF, right? So when the case scenario is telling you like, man, it's really good, it's really perfect, but it's not the first thing you need to do, right? So in this particular scenario, letter D is actually incorrect, and the correct answer is letter C. So the first thing you need to do as a nurse is to position the patient and administer that oxygen as ordered. And then the next thing you do would be to give Lasix and then call the labs and call the ECG department to get for the labs to get the BNP and for the ECG department to get the 12-lead EKG. So that's how to answer the question. I want you to think as a nurse. I know you're in nursing school and you're about to graduate or you already graduated and you're watching this video. That's how to answer this NCLEX question. So remember, stay focused, think safety because the NCLEX exam is safety exam and pass the NCLEX. So if you could share this video with your classmates and if you haven't followed, subscribe to this account, please do so. That would help us. That will help me a lot. Thank you for watching.